Hi guys, how are you doing? I hope you are doing well and welcome. Um, Today we are going to learn about breast cancer. So I want us to learn the cause of breast cancer, the symptoms, prevention measures, and early diagnosis that will lead to early treatment. So, welcome to today's learning session. And if you have not subscribed to this YouTube channel, please subscribe. Also, if you have any question, feel free to ask down there in the comment section. Feel free to share this video, give it a thumbs up, and also you can share so that we can continue learning. Okay, so what is breast cancer? Breast cancer is a cancer that forms in the cells of the breast. Okay, it occurs in both male and female, but it's most common in female. Okay, breast cancer is a cancer that occurs in the cells of the breast. It can occur in both male and female, but mostly it's common in women. Okay, so the cause of breast cancer is unknown. But what happens is the breast cells begin to grow abnormally. Okay, they grow abnormally, they multiply so fast, and then these abnormal cells, they don't die. So these accumulating cells are the ones that form a mass, and that is what is called a cancer or a tumor. Okay, these cells divide more rapidly than healthy cells, and they don't die. Healthy cells produce in a set time. Okay, there's a way God created us. Cells are being produced in our bodies in a way that healthy cells, they reproduce and then they die after some time. Okay, the body has a continuous way it makes cells. So they are produced, after sometimes they die, and when the old cells die, you find that the body has produced new cells. But in a case of cancer, the cells are produced abnormally and very rapidly. That means they are abnormal, and then they are produced, many of them, and then these cells, they don't die. So these accumulating cells are the ones that form a lump or a mass, and that is a cancer. Okay, so what are the signs of breast cancer? This is the most important part. Okay, because you have to know the signs. And any cancer, early diagnosis can lead to a good outcome, because if it's diagnosed early, then it's treated and it can be prevented. Okay, these precancerous forms can be stopped from growing or developing to cancer cells. Okay, so number one sign of breast cancer is a breast lump. Okay, or let me just call it a mass. Okay, a lump. This is a thickening that feels different from surrounding tissue. Actually, a breast lump is the first sign of cancer of the breast. Okay, and this you can know this through palpating, or let's say by feeling during a normal routine breast screening. Okay, or self exam. maybe you are having a shower and you are trying to do a breast exam, and then you notice a lump. Okay, this is a thickening. A lump is a thickening. You will feel inside a breast that is different from the surrounding tissue. Okay, it is like a small mass. If you feel any small lump or any big lump inside your breast, please you should be concerned and you need to seek medical attention very fast. It's okay if you go then for the doctor to know what it is. If it's not a cancer, it is okay, and if it's a cancer, early treatment can start. So the first sign of breast cancer is a breast lump. Okay, number 2, we have change in size, shape, or appearance of a breast. Okay, in the next lesson, I want us to learn about breast self exam. I will let you know how you can do a breast self exam at home. But this second point means if you notice a change in the size of your breast, okay, the shape of the breast, or appearance. Okay, if you notice any change in the size, maybe it becomes big, one breast becomes bigger than the other. In the shape, okay, we have you can notice that maybe a nipple, your nipple is inverted. Or appearance, you know the normal appearance of your breast. If you notice any change, okay, you need to go to the hospital. That is a number 2 sign of breast cancer. We have a newly inverted nipple. That is what I have just told you. You know how your normal nipples appear. If you notice that your nipple starts to invert to the inwards, please, you must be concerned. Okay, that is number 3 sign. We have breast pain. Okay, you notice that whenever you touch your breast, you feel pain. We have discharge from your nipple, that is bloodish. Any discharge from your nipple when you are not breastfeeding, and then you notice you have a discharge from your nipple, that you should be concerned with that. We have you notice a pigmented area of the skin of the breast. If you notice that your skin, your breast skin, just a point or a certain area starts getting pigmented. We have redness of the skin of the breast. Okay, these are some of the signs of breast cancer, but I told you the first sign is a lump inside your breast. Okay, so those are some of the signs of breast cancer. Please, if you notice that you have any changes with your breast, you better seek medical attention early. You don't have to wait maybe to feel pain. If you notice any changes in the skin, in the appearance, in the size, changes with your nipples, okay, pain, discharge from your nipple, those are some of the signs of an abnormal breast. So please, you need to seek medical attention as early as possible. Okay, so what are the risks of getting breast cancer? Risk factors. Number 1, we have inherited genes, which are passed through generations of the family. By this I mean breast cancer can run in families. Okay, so if a member of your family, maybe your mom, your grandmom, your aunt, has breast cancer, these genes can be passed through generations. So if you have a member of the family who has breast cancer, then you are among the people who are at risk of getting breast cancer. And what can you do? Normalize doing breast self exams, so that in any case there is an abnormality or any problem, it can be noticed early. We have being female. Being female, the fact that you are a female, you are at risk of getting breast cancer. We have increasing age. This means as you age, your risk of getting breast cancer increases. You have personal history of breast cancer. If you had a breast cancer in one of your breasts, there is a risk that your other breast can develop cancer of the cancer of the breast. We have family history, and I have explained this. If it can run, the genes can run in the genes can be passed in family generations. We have obesity. Being overweight is a risk factor of having breast cancer. We have exposure to radiation of the chest at an early age. If during your early age you were exposed to radiation of the chest, let's say something like this chest x-rays or any radiation that was exposed to your chest when you were young is a risk factor of developing breast cancer. We have alcohol intake. We have hormone therapy. Hormone therapy that contains estrogen and progesterone. So there we have those oral contraceptives that has both estrogen and progesterone. Oral contraceptives, combined oral contraceptives. Those ones, they put you at a risk of getting breast cancer. We have having never been pregnant or having never breastfed. If you have never breastfed, that's also another risk factor of developing breast cancer. So as you can see, the risk factors are wide. They are very wide, and also you can fall under these people who are at a risk factor and still you don't get cancer. So it doesn't mean that if you lie under the people who are in the risk factors you will get cancer, but just be careful, be keen with your body, so that in case of any changes you can notice early. So how can we prevent breast cancer? We have breast screening. Breast screening. If you notice any problem with your breast, go to the hospital for screening. We have x-rays, we have mammograms, we have ultrasounds, MRIs, all those investigations that can be done to the breast. We have breast self exams. Normalize doing a breast self exam at home, so that you can feel for any lumps in your breast as early as possible. We have avoid alcohol. We have said it's among the risk factors. Maintain a healthy weight. We have said obesity is among the risk factors. And then limit postmenopausal hormone therapy. You see, when a lady reaches menopause, there are those extreme symptoms of menopause, like hot flashes, mood swings, those extreme hormonal changes caused by hormonal imbalances. And some ladies start using medications, to help relieve the symptoms, and these medications are called postmenopausal hormonal therapy, and they have been linked to cancer of the breast. So in any case, if you can try to avoid these medications, you will be in a better space. Diagnosis. How is diagnosis of breast cancer made? We have routine screening. maybe you come to the hospital for a routine breast screening, and then the diagnosis can be made. Maybe you are coming for a normal routine screening, you had no issues, then your doctor notices that you have a lump. From there, then the diagnosis can be made. If you happen to have cancer of the breast, we have symptoms. Through symptoms, I have told you the symptoms of cancer. So once you explain these symptoms to doctor, symptoms can make a diagnosis, but your doctor will go ahead and do more investigations. We have imaging like mammograms. This is an X-ray that shows if you have a lump. It can help to diagnose cancer of the breast. We have ultrasound, MRI. We also have what we call biopsy. Now this is the final. This biopsy is the one that is used to make a final diagnosis of cancer of the breast. And what happens is they extract a sample from the tissue or the lump. They send it to the lab, okay, and then it's for analysis. The results are the ones that show if the cells are cancerous or not, okay. So what is treatment? Any cancer, if diagnosed early and treatment is started early, the outcome will be good. But if it has advanced, okay, then there is no cure. What happens is you will go for chemotherapy, radiotherapy, and these ones are cytotoxic drugs that kill cancer cells. Radiation therapy uses radiation to kill those cancerous cells. But then remember, this radiation or chemotherapy, they just kill the cells, but your body continues producing some more, okay. The ones that have been produced are killed, but your body continues to produce more abnormal cells, okay, meaning there's no treatment. This one is just used to control the rate at which those cancer cells are spreading in your body. So we also have surgery. Surgery can be helpful when this cancer is diagnosed early, where we have a mastectomy. Maybe your doctor will explain to you. He can decide to do a surgery to remove your breast. That is if the cancer cells have not spread to the nearby tissues. You will discuss with your doctor, and that is it. Actually, cancer has no cure. That is why we emphasize on routine screening, so that any problem can be diagnosed early and treatment can be started early, okay. So yes, that is the simple discussion of cancer of the breast. In the next lesson, I want us to learn on how to do a self breast exam, okay. So please make sure you watch this video, share it, and also if you have not subscribed to this YouTube channel, please subscribe. Let's grow this channel. Thank you for tuning in. See you in the next session of learning.